On a medical watch now, whooping cough is skyrocketing. The dangerous and potentially deadly childhood infection is 5 times more prevalent this year compared to last. So today we're tackling this important topic with more on the respiratory disease, how to prevent it, and why it's so important. Dr. David Wynn, Rush University pediatric infectious disease specialist, joins us now. Thank you for being here.
Thank you for having me come talk about this very important
So
topic.
if you've ever heard it, and I have as a parent, sadly, you know, but if you haven't, tell us about the symptoms and that distinctive cough.
Sure. So pertussis or whooping cough starts out as a pretty usual looking kind of cold with runny nose and cough, but then after a couple weeks, you start to have those characteristic coughing fits. You can have as many as 5 to 10 in a row, and the whoop is the reason for the name. It comes from taking in a breath during that fit of coughing, and that phase can last several weeks.
And I feel like it sounds more like a bark. Who is at greatest risk?
The people, the populations that are at the greatest risk for having bad whooping cough are young babies. So usually we say under 6 months. So it would be annoying for you or me, or older children, but for the little babies with the little lungs, they don't have as much of a reserve, so it could actually even stop their breathing and at worst case cause death.
It is so scary to see them gasping like that. Going from about 200 cases last year to nearly 1,100 this year, why the increase?
Well, the most obvious correlation right now is the decrease in the vaccination rates. And there could be many reasons for that, one being vaccine hesitancy, but also we might still be seeing this as a effect of lack of primary care during the COVID years when people had to not be able to go see their doctors in person and get vaccines in person. But that is probably the strongest link between the waning herd immunity. Yeah.
Talk a little bit more about the vaccine. Do parents need it every year? When do they get it for their children?
You don't need it every year. Kids get it as part of the routine vaccines in early childhood. So if they're going to see their pediatrician, getting ready their regular visits, they should be getting that series. It's definitely needed for school. They usually get a booster in their teenage or early teenage years. And then afterwards, many of us might need to get it boosted every 10 years. Usually they're focusing on the tetanus at that point, but because it's co-formulated with the pertussis vaccine, but it's, you get the protection from there too. And then also very importantly, pregnant mothers will be vaccinated with each pregnancy to try and both increase the antibodies and prevent transmitting the infection to babies.
Doctor, how does it manifest itself in adults?
It's kind of like how I described before, just
Okay.
the cold symptoms for 2 weeks, and then the very annoying coughing fits with that whoop in interrupting the coughing fits.
Well, thanks for all the information. We've been so focused, I think, on COVID and the flu, but this is really important as well, especially since the vaccines are required once kids go to school, but this is affecting 1 to 3-year-olds. Dr. Wynn, thank you so much.
No problem.
You can check out more at rush.edu.
Coming